Estella, and I'm a holistic health coach, and I specialize in transformational change. I want to start by introducing myself, and then I'd like to get up close and personal with you and talk to you a little bit about health. I was born in Indianapolis and attended college in Dallas, Texas. I joined Abbott Laboratories in California, which is a global pharmaceutical healthcare company, and I was hoping to make a major contribution to health. While working at Abbott Laboratories, I completed my MBA at Pepperdine University. So now I'm a holistic health coach, and my passion for health is why I'm speaking with you today. Health and wellness is the biggest blessing we have, and we are living our lives and putting our lives in jeopardy because of the damage we're doing to it. Yes, the health crisis is becoming global. It's an epidemic. Before, the #1 cause of death was infection, and now it's actually behavior diseases that are preventable. 60% of the deaths are now attributed to things like heart disease, cancer, diabetes, and these are preventable, curable diseases. I'm very, very concerned, which you should be. Healthcare needs to move from what we've gotten into, which is a fix-it, find-it model, to more of a predictive, preventive one. You see, healthy living is a choice, and that choice comes from my roots. My father was a pharmacist and my grandfather a medical physician, both having a thrust for knowledge and a passion to cure. Unfortunately, they lived a great life, but not a total holistic one. So many of you might think, okay, Estella, I hear you, but it's too late for me to change, or it may be even too early. I feel fine. Well, I'd like to share with you a couple of stories demonstrating that it's never too late or too early to make that change and the right choices. Sarah was 20 years old. She had parents that died of heart disease and diabetes when she was 10 and 13. She lost her parents early in life. At 20, she herself was diagnosed with a heart disease that was needed an operation to survive. She needed that to survive. Well, Sarah opted not to perform the surgery, and instead she chose the lifestyle change. Today, 30 years later, the now Dr. Sarah is a homeopathic doctor transforming the lives of others. My father, he was another example. At 45, he was diagnosed with a heart disease and had his first open heart surgery at 45. Not wanting to give up soul food, like we ethnic folks call it, he later had 2 other open heart surgeries, and then he passed. My dad died from a curable, preventable disease, a behavior problem. He didn't make the right choice, but you can at 45. And then there's Helen. Helen's my role model. She's 86, absolutely beautiful. She went to all my fitness classes, could do everything from step to cycling, everything. From the back, she looked like she was 20 years old. So Helen came to me as a client and wanted to make a lifestyle change at 86. She was older, and as you get older, you need to change your nutritional habits and sometimes add more animal proteins to your diet. So I work with her to do that. Helen continues to transform, and she's 99 now. So with that said, it's never too late to make that change and to transform yourself by living a healthy lifestyle. So what is the solution? Where you are. I am and you are. We need to take a vested interest in our health, and we can easily do that. And here are just 5 tips that I'm going to leave you with that can transform your life. First, become educated about your health. I teach a series of wellness and nutrition classes, workshops, all in an effort to educate you on how you can change yourself. There are integrative medicine doctors that have found that inflammation is a major cause of some of these behavior diseases, and we need to put a stop to that by educating ourselves. Secondly, learn to shop. There are many affordable options out there at all these health food stores, and you can get, if you can't afford it, grow it. You can grow it right in your garden, especially some of those things that are very contaminated if preservatives are sprayed on them. Next, know the effects of prescription drugs. Take a look at what you're taking. Investigate the healing properties of food. Maybe you can replace some of those drugs with food and exercise. It's possible. And understand also what interactions are happening with the drugs you're taking. And exercise. Exercise not so intensely, but more regularly. Weekend warriors don't maintain an exercise program. I love that commercial where the lady is going to look for an exercise class, and after countless trials at going to different classes, she finds her passion, and that was walking. It's that simple. 15 minutes out, 15 minutes back, you've already done 30 minutes. And last but not least, enlist the support of a health coach. It's hard to make change sometimes alone. A coach is going to help you through this change process and identify the blockage that's preventing those breakthrough results. I call changing things a complete package. Your primary foods, which are your spirit and your mind, and your secondary food, which is your body. You can't change one without the other. So I'm leaving you today with telling you that only you can make a difference in developing a health and wellness program for you and your family. You can either take the find it, fix it approach, or make the better choice, which is the prevent it, predict it approach. I'll leave you with a quote from George Carlin. Cherish your health. If it's good, preserve it. If it's unstable, improve it. If it's beyond what you can improve, then seek help. Thank you and keep healthy.